Hi everyone, it's Dr. Elaine Lewis here, and today we are going to talk about thyroid testing. Now, the thyroid is a gland that just kind of sits right over here on your neck, kind of hugging your Adam's apple or your Eve's apple, as I like to sometimes call it. And essentially what it does is it helps to regulate your metabolic rate. So all of the various cells in the body, the speed at which they function, the thyroid is plays an important role for that. So when it comes to thyroid function, there are 3 basic tests that can be done, and then a host of additional tests that can be done to determine whether the thyroid is functioning optimally. The very first test that is quite routinely tested from a conventional standpoint as well, so when we're just getting a basic sense of how the thyroid is functioning, is called thyroid stimulating hormone, or TSH. Now, I call TSH the thyroid supervising hormone because it's actually not a thyroid hormone itself. It's more like a supervisor of the thyroid. So the TSH is actually a hormone that's released from the brain, from this tiny little gland called the pituitary gland in the brain, and it is released in response to how well the thyroid is actually functioning. So it's a good indirect assessment of thyroid function, but it doesn't actually give us a good sense of the activity in the thyroid as it is at this moment, because it often is changed after the thyroid has been behaving one way or the other, either too active or underactive for a longer period of time. Now, because this is the case with TSH, because it takes a little bit of time for it to actually change, we consider it to be a little bit more of a stable form of assessing the thyroid, but it doesn't tell us about any predictive changes that are occurring in the thyroid before it's, for lack of a better term, too late. So by the time the TSH is actually affected, whether it's too high or too low, the thyroid generally at this point is a state of more serious disease or dysfunction, and we usually have to intervene a bit more strongly. So I generally like to intervene prior to the TSH being abnormal, which is why I rely a lot on additional testing that tells me about the function of the thyroid gland. Okay, so just to kind of give you a little bit more of a sense of what the TSH actually tells us, again, it's a supervising hormone. So, it's going to go up, it's going to be higher if the thyroid itself is not working very well. So a way to think about it is, if the workers aren't working very well, then the supervisor's got to yell louder. So it's got to be louder, it's got to be bigger, it's going to go higher in value on a blood test. Right? Now, if the opposite is true, if the thyroid is functioning optimally, or if the thyroid is functioning too much, so it's overactive, then the TSH is going to be lower with time. And sometimes we see an abnormally low TSH, and we call that a suppressed TSH. And that's typically because the thyroid hormones, which I'm going to speak about next, are active enough or too active. All right, so that's the TSH, again, a little bit more of an indirect assessment, and it tells us an inverse relationship with what's going on with the thyroid. So if it's too high, generally the thyroid is underfunctioning, and if it's too low, then generally the thyroid is overfunctioning or functioning normally, which is why we like to look at the other values coming up next. So the other 2 hormones that are relatively standard to test are T3 and T4, also known as free T3 or free T4. That's generally how I like to test it. And these 2 hormones themselves are actual thyroid hormones. So they're released from the actual thyroid hanging out right here versus the TSH, which is released from the brain. Okay, so T4 and T3, both important thyroid hormones with a slightly different level of activity. The T4 hormone, so free T4, which is how we measure it in the blood, that is actually more predominantly released from the thyroid. So the thyroid releases itself the majority of the T4 that we test. And then T4 is converted to a more active form of thyroid hormone, which is T3. Okay, so just to reiterate, because this can get a little bit complicated, the thyroid gland itself releases T4. and then T4 is converted to T3, which is a more active thyroid hormone. Okay, now just for a little bit for interest's sake, for anyone who's on thyroid prescription, meaning a medication, a synthetic form of regulating your thyroid, often it's Synthroid or thyroxine, this is actually T4. So it's basically a synthetic form of T4, and your body is required then to convert that hormone or that medication to the active form of hormone, which is T3. Okay, so I generally like to see both T4 and T3 in blood work to get a sense of how much of each hormone your body has, because both of these hormones are important for regulating the metabolic rate. T3 being a little bit more of an active form, so I generally do like to see T3 as being as active as possible. So generally I like to see T3 on the higher end of the range versus T4 I'd like to see generally in the middle of the range. Okay, and depending on what the lab reference range is, that's going to vary a little bit, but or whether you're in US or Canada or in other countries, we have a slightly different metric system for how we measure these various lab tests. Okay, so again, T4 released from the thyroid, converted to T3. I like to see both of them, and that conversion is often where people run into trouble. So the conversion from inactive, so to speak, it's very low activity T4. So converting from inactive T4 to active T3, that conversion is regulated by a few things. The first most important thing is the adrenal gland, which is responsible for chronic stress. So chronic stress can impede the conversion from T4 to T3. The next major thing are your sex hormones. So in women, the predominant ones there are estrogen and progesterone. In women and men, you also have, you have all of them in women and men, but more predominantly in women, estrogen and progesterone. And then in men, more predominantly the androgens, which are testosterone and DHEA. Okay, so those hormones are also going to be impacting the conversion of T4 to T3. The next thing is your digestive system. Now, we all know that digestion is kind of at the very foundational level of our health, and certainly is the case here when it comes to thyroid function. And so digestive function, or how optimal your absorption of nutrients are through the gut, is going to influence your conversion of T4 to the active T3. The next thing is inflammation. So you may have overt signs of inflammation like joint pain, muscle pain, cardiovascular disease, even mental health issues like depression and anxiety are inflammatory within the body. So we may have overt signs of inflammation, or we may just see it incidentally through other blood work, but inflammation plays a major role in T4 to T3 conversion. And then the last thing is your nutrients themselves. So there are very specific nutrients that play a major role in that conversion from T4 to T3. The big bulk of them are your vitamins. So typically your B vitamins, so vitamin B12, we talk a little bit more about, but all of your other B vitamins are very important to be. They act as cofactors, which are basically like little helpers to convert T4 to T3. And then other minerals in the body like magnesium, selenium, zinc, iodine, all of these are very important as well for that conversion piece from T4 to T3. Okay, so when we're looking at that conversion, I like to think about it as the body really protecting itself, meaning that, if you have a high degree of stress, meaning that your adrenal gland is not working very well, if you have hormonal dysfunction, if you have inflammation, if you have digestive issues, or if your nutrients aren't optimized because maybe of a poor diet, or maybe because you're not getting it well enough absorbed through the digestive system, then of course your body is not going to want your thyroid gland to be working that well, right? Your body is going to want to preserve resources and conserve energy, and it's going to dial down your metabolic rate in order to protect you. So that's a really important kind of concept to think about, because we often think, why are all of these things important? Well, of course they're important. Why would your body want to expend excess energy it doesn't have if all of these things are going on? right? So that's, a way that I like to describe it to my patients as well. And that also allows for us to think about the thyroid gland in a little bit more of a holistic way and treat a little bit more upstream and think about those root causes that may be influencing an inadequate or a poorer absorption. Okay, and then the final thing I'll say about T3 is that, as I mentioned, it's the more active form of the thyroid, and so it essentially is the major driver, really, of the metabolic rate. And so, how fast your cells are functioning, the speed at which they're functioning is dictated primarily by free T3 because it is the more active form of the thyroid hormone. And so, the speed at which you're thinking, the speed at which your body is metabolizing and allowing for you to lose weight, the speed at which your digestive system is functioning, all of these things are related to this specific, hormone picture. And so it really is a big effect that the thyroid can have on the body. And it can relate to quite a few different symptoms if it's on the low side. So some common symptoms that we see that are related to sluggish thyroid or decreased thyroid function are low energy or fatigue. We often see hair loss or hair shedding, or dry hair, brittle hair. These things can also be seen when it comes to thyroid function. Skin that's dry or skin that's cracking easily. We also see nails that are really thin or breaking, not able to kind of grow as quickly as one would like. We see weight gain. I think I already mentioned that. We see a tendency towards constipation. And then another pretty classic symptom is a tendency towards feeling more cold. And, we can think about that as just, a little bit more intuitive because as your metabolism is slower, you're not going to feel as warm. So if you're the type of person that's always wanting to grab a sweater when everybody else is fine, then you may want to think about, whether your temperature regulation is related to thyroid regulation. Okay, I hope all of that made sense. Okay, the next couple of lab tests that are really important for determining how your thyroid is functioning is the antibodies that we can test that may be present if you have either a low functioning thyroid or a hyper functioning or elevated thyroid function. And those are anti-thyroglobulin or anti-TG, and then anti-thyroperoxidase, which is anti-TPO, short form. So these two antibodies, when detected in high amounts, tell us that what's going on in your body is an autoimmune activity. And so when we see antibodies that are present, that are autoantibodies, meaning that these antibodies are actually the immune system mounting an attack on itself, in this case, on its own thyroid gland. So your body, for some reason, is inappropriately reacting when it comes to the immune system and creating or mounting a response to the thyroid gland itself, then this will slightly shift the way that the thyroid is actually treated. So we obviously would focus a little bit more on autoimmune support as opposed to simply looking at the thyroid as a variant of a little bit more of a common condition. So when it comes to autoimmune thyroid dysfunction, in women especially, this is the majority of cases. So when we actually see a hypothyroidism or a hyperthyroidism, meaning an overt clinical distinction compared to what I'm talking about, which is a functional hypothyroidism or a functional hyperthyroidism. What that means is that those clinical cases, so those more severe cases where your TSH is also abnormal, those cases most commonly are associated with autoimmune activity. And so our goal when we're looking at things from more of a functional standpoint, where we're actually looking at the T3 and the T4 and some of these other nutrients that I'm going to talk about in a second, our goal when we're kind of assessing it in this way is to ideally catch changes that are occurring in the thyroid before we see a more drastic or severe condition. So ideally when we're measuring it from a functional standpoint, we're kind of a little bit in that gray zone where, things aren't quite optimal, but they're also not so far down the rabbit hole that we need to require pharmaceutical intervention, but we can kind of move the thyroid gland into a little bit more optimal functioning. Generally, we don't see a ton of autoimmune activity at this stage, although I have, but it's really important to determine whether that is the case so that we can treat it accordingly. Okay, so those again were those autoimmune antibodies, anti-TPO and anti-TG. Okay, and then the final group of tests that I like to run to get a sense of how the thyroid is functioning is what I was mentioning before. Are one of the factors that can affect T4 to T3 conversion, and those are the nutrients. And so when we're looking at nutrients that can affect thyroid function, these would include iron, or tested as ferritin, vitamin D, vitamin B12. Some of the other B vitamins can also be tested in more of a functional assessment, but I generally will just do routine blood work for this. And then we also look at some of the minerals like magnesium. Typically I tested as RBC magnesium, selenium, zinc, and iodine as well. And generally iodine we test in urine. So all of those nutrients can play a pretty major role in the effect of T4 to T3 conversion, or how optimal that actually is. And by doing that can really affect the overall functioning of the thyroid. So generally when I look at all of these various tests, starting from the more conventional TSH down through a bit more of a functional way of assessing, T4, T3, the antibodies, TPO and TG, and then finally all of these nutrients, it really helps for us to assess and manage things before they get a little bit too severe. So I hope you found this information useful. It's certainly a ton of the patients that I see, because I see a lot of women's health. We are doing a lot of assessment of this kind in order to protect women's thyroids before, before they get a little bit too severe. So if you are finding any of those classic symptoms that I had mentioned before, like hair changes, skin changes, nail changes, tendency towards constipation when it comes to digestion, or other symptoms like bloating and gas, or you're feeling like your metabolism is too slow and you're noticing things like weight gain or low energy, then the thyroid testing and this kind of testing in a more functional way would be something I'd highly suggest you do. All right, so that's it for this video. I hope you found that this information was helpful, and I will catch you the next time. Take care.